Surgeon General is right. It's going to be bad this week. It's going to be worse the following week. I mean, we have to be honest about this. This is just a beginning. I don't mean that, to be anything but blunt and honest with New Yorkers and all Americans. It's the beginning of something that will get worse throughout April and into May. And we've got to brace ourselves and we've got to change our lives. And we absolutely need help from Washington. There's no way, not only this city, the greatest, largest city in the country, we're struggling and we need help. But imagine, John, as this spreads, all of the cities, all of the towns, all of the counties around this country that are going to be overwhelmed. The only way they can make it through is with federal help. And right now that's hanging in the balance in Washington. So, John, I want to appeal to everyone in the House and Senate. You have got to help cities, towns, counties, states, public hospitals, private hospitals. You've got to give all of us direct relief because we're losing billions of dollars day after day, week after week. No more revenue coming in. You know that, John. But we still have to serve people. We still have to save lives. And we need that help from Washington starting today. John, I think what the Democrats are saying, I think oversight's part of it, but they're saying we should not prioritize bailouts for the airlines and the big corporations. The first bailout should go to the American people. Millions of people have lost their jobs suddenly. So money back in the pockets of working people, and then help cities, towns, counties, states to be able to handle extraordinary, huge new needs that we simply can't handle. I mean, you're going to see cities and towns and counties go broke unless there is this direct aid that needs to be in this package. And of course, direct aid to hospitals. That's what Democrats are fighting for. Because we're at a point literally this week where our public hospital system, the largest in the country, is getting increasingly stressed and running out of equipment. So that operation at the Javits Center could be a lifesaver for us. We expect to see a lot of that up and running this week, but we're still waiting for, to see it and get the final details in place. No, I spoke to President Trump and Vice President Pence last night in detail, and I'm glad we had the conversation, and I appreciated the focus of the conversation. But what I want to see is the real material support for the people of my city, 8.6 million people who are right now in the crosshairs, as you said, the epicenter for America. We have not yet seen quantities of ventilators, of masks, of all the supplies we need. And I went over it with the president and vice president. The ventilators, if we don't get a supply of ventilators quickly, our public hospital system, literally after about a week or so, we will not have enough ventilators to keep people alive who could live through this crisis and could be saved. And then even after equipment, John, I talked to the president and vice president about personnel. There's not going to be enough medical personnel in New York. We're going to need help from the military and from other parts of the country. And we talked, of course, about direct aid in the stimulus bill. If we don't get all those things, our hospital system will not be able to hold. Look, I don't want to typify their part of the conversation. That's for them. I will say I'm appreciative that they took the time and we went into real detail, but I made clear to them what I need right now is action, not words, and every day counts because we're literally in that very tight window now that if we don't get the ventilators in particular, we will actually start to lose lives who could have been saved. Dan, honestly, I think for all of us, it took days and weeks to fully understand the magnitude of this. But now that we do, we have to do this intense social distancing. We have to do these shelter-in-place measures as New York and California have done. They need to be everywhere because here's the reality. This is a disease that unless you cut off its oxygen, if you will, which is to stop people from having all the kind of interaction we're used to as human beings, unless you create social distancing, it moves so fast, John, that it simply overwhelms any effort by the healthcare community to address it, and therefore thousands of lives will be lost that could have been saved. It's as simple as that. And I think we have to take these extreme measures, but it's not forever. I mean, that's why I'm trying to get people in my town acclimated to, we have a couple of rough months ahead, but then you come out the other end. John, how many members of our family, especially our older relatives who are the people, really vulnerable here, are we simply saying as a nation, we're going to turn away and ignore the challenges facing them? I don't think that's right. I think we have to understand that if we act intensely, we can save thousands, tens of thousands of lives all over this country and stop this thing from becoming even more total and more intense And we have to recognize if coronavirus was not checked in some ways and slowed, then you're talking about a healthcare system that can't function at all, including for all the people with other challenges, with all the other healthcare challenges we deal with all the time. So I understand people who say, wow, this is an extraordinary sacrifice. It is. But if you don't slow this thing down, they'll sacrifice a lot more on the other end of the equation. And we got to think about the human cost here. In our public hospitals, our 11 public hospitals right now, this week, I can only guarantee you right now, John, that we can get through this week with the equipment and supplies we have. That's the blunt reality. If we don't get some relief quickly, and I can count, John, I literally want to see hundreds of ventilators. I want to see, first hundreds of thousands and millions of masks. If that doesn't come in starting this week, we will get to a point where people can't be saved who could have been saved. Even just a few days ago, I thought we could get safely into April. It's moving so fast right now that I can't even say that anymore. Our public hospitals handle the toughest cases and the folks with the biggest healthcare problems, the fewest resources. If we don't get ventilators this week, we are going to start losing lives we could have saved. I can't be blunter than that. And I appealed to the president and vice president. I've appealed to the private sector. And I'll say it to everyone watching right now. Anyone in the United States of America who has a ventilator that you can get to New York City, we need it now. We need to save lives. We need it now.